Hello, everyone, and welcome to Reaching LA City Immigrants Response and Resources during the COVID 19 pandemic, hosted by the Human Relations Commission Immigration Ad Hoc Committee and the Civil Human Rights and Equity Department. My name is Angelica Solis Montero. I'm the president of the Human Relations Commission, and I'm honored to serve as your moderator for today's event. Today, we have gathered leaders in public health, housing, and city services to share critically needed resources and information with community organizations serving Los Angeles immigrants. We know that trusted local community organizations are in the best position to get critical information out to immigrant communities. And because immigrants are so uniquely impacted by this pandemic, we want to host an event that was designed to support and empower you. This webinar is in English, but a Spanish translation of the event will be posted on civilandhumanrights.lacity.org in the coming days. The LA City Human Relations Commission was created in 1965 to promote intergroup peace building, equity, and human rights in the city of Los Angeles. And we are honored to bring you this event today. Our members are appointed by the mayor and represent many diverse communities across Los Angeles. If you want to learn more about the commission or attend a meeting, and I highly encourage you to do so, find more information at civilandhumanrights.lacity.org. We have a lot of great speakers and panelists today, and we want to get to the important information that they have to share to you. But first, we have some welcome remarks by our great mayor, LA Mayor Eric Garcetti.
Hello, I'm Mayor Eric Garcetti, and I want to welcome you to the Civil, Human Rights, and Equity Department's COVID-19 City of Los Angeles Response Reaching LA's Immigrant Populations webinar. Whew, that's a mouthful. But first, let me thank the Human Relations Commission and the ad hoc committee that planned this important event. It is so critical that our immigrant and refugee communities know that the City of Los Angeles is here for you. And now more than ever, it's absolutely vital that our programs and services are accessible to all Angelenos, regardless of their immigration status. Many of our immigrant and refugee neighbors are working around the clock as essential workers, whether it's in grocery stores or in our hospitals, and they are being disproportionately impacted by COVID-19. We are all so grateful for their service and will continue to do our very best to protect them. And that includes continuing the work to ensure that we eliminate any barriers to accessing life-saving programs and resources, from COVID-19 testing and vaccines to programs that provide financial assistance so families can keep a roof over their heads and food on the table every night. We are living in unprecedented times, and we are in urgent need of additional federal and state support to keep our city on the road to recovery. So you can count on me to continue to advocate for additional COVID-19 relief for immigrants and refugees from both Governor Newsom and from the Biden-Harris administration. And isn't it nice to say that? To everyone joining us today, please know that the City of Los Angeles is on your side, that we will get through this together. And as always, strength and love, Los Angeles. Thank you, and enjoy the rest of the webinar.
Thank you so much, Mr. Mayor. I'm pleased to introduce our next speaker, Capri Maddox. Ms. Maddox is Executive Director of the Los Angeles Civil, Human Rights, and Equity Department, as well as the city's Chief Equity Officer for COVID-19 response. An accomplished attorney, Ms. Maddox has also served as Senior Advisor to City Attorney Mike Feuer, Executive Director of Partnerships for LAUSD, and President of the Los Angeles Board of Public Works. Please welcome Ms. Capri Maddox.
Thank you so much, Madam Commissioner. Really grateful for the opportunity to be here. Want to thank everyone for being a part of the Reaching Los Angeles for City Immigrants event. This is intended as a response to the COVID-19 crisis that we are dealing with. This webinar is designed to support us, our service providers and community organizations that are serving the Los Angeles immigrant communities. This webinar is hosted by the Los Angeles Department dealing with civil rights. However, but I want to be sure that you know that the Human Relations Commission and the Civil and Human Rights and Equity Department could not have done this without the work of our ad hoc committee on immigration. And I'd like to share a slide with so you can see the members of this group. The Immigration Ad Hoc Committee has worked for months to design a webinar that is informative, enlightening, and effective at reaching our immigrant communities. Special thanks to the Ad Hoc Committee Chair, Irene Tovar, and the Immigration Ad Hoc Committee members, Madam President Angelica Solis Montero, and who is also today's moderator, as well as Irma Becerra Nunez, who is the first vice president of the commission, Anthony Mack, who is the second vice president of the commission, and last but not least, our very own Melanie de la Cruz Vesca. These commissioners represent a diverse cross-section of Los Angeles and work tirelessly to serve our community with equity and inclusion. We are so grateful for their tireless work for immigrant communities of Los Angeles. I also want to thank Councilmember Gil Cedillo for his leadership in serving LA's immigrant communities, as well as his commitment to justice and equity in helping create the LA Civil Rights Department. Mayor Garcetti helped us with his leadership in this space, particularly during the COVID crisis, and has continued to pay attention to the underserved communities, particularly the immigrant communities in the city of Los Angeles. In addition, I'd like to thank LA This Week for hosting this event and making sure that this message gets out to a number of our residents in Los Angeles. And then, of course, could not do this without our staff from the LA Civil Rights Department. Definitely want to thank Mark, Tammy, Jamana, and others from our team for making today possible. And then our panelists, I mean, for taking the time to share their knowledge and resources as it relates to serving the immigrant population in our city. They make up the beautiful mosaic of our city and our region. Wanted to thank you, all for your work, but definitely wanted to say that the pandemic has ravaged the people of Los Angeles. And although we're all in this together, some communities are hit harder by this crisis. And the case numbers have recently been going down, which is welcome news, but we know that the immigrant communities, particularly in the Latino community, are disproportionately API communities are all catching COVID at higher rates than their white counterparts, and they're suffering more from this illness. The Latino population is especially impacted with a mortality rate that is 3 times higher than white Angelenos. Not only are immigrants more likely to hold essential jobs, which puts them at greater risk for COVID-19, but they are also likely to face financial impacts and significant hardships from the pandemic. Again, we have members that are more likely to be renters than homeowners, and they're more likely to be losing their jobs in an economic downturn. I mean, there are some folks that had, 3 jobs before the pandemic and were able to, unfortunately, have to work 3 jobs to sustain themselves, but now they're in a position where they have lost 1 or more of those jobs. These are hardworking folks that are making a difference in our region. Immigrants, especially undocumented immigrants, often do not know their rights and resources that are available to them in the city of Los Angeles. And then furthermore, the fear and distrust of government makes it even harder for immigrants to access the resources that are needed. And this is why this webinar is reaching out to you, community service providers. You guys are trusted sources and resources in your community. When you're empowered with the latest information, we all do better. And that's why the Civil Rights Department is here to help you as you serve others. We are your allies in equity, empowerment, and serving the most marginalized members of the Los Angeles community. We have partnered with city leaders on encouraging COVID testing in public housing development. We have distributed more than 1,500 thermometers to high need populations just as a department, and other work has been done citywide, particularly as it relates to meals programs and other activities. This department was created last year to protect Angelenos from discrimination in the private sector as it relates to commerce, education, employment, and housing, but most of all to serve underserved communities, to build equity in business city policy, through programming, and much more. We work with our commissioners, like the Human Relations Commissioners, but we also work with neighborhood councils, private businesses, the philanthropic community, colleges and universities, and others. To learn more about our work and service to the City of Los Angeles, please visit our website, which is civilandhumanrights.lacity.org, or follow us at LA Civil Rights. Thank you. I'll yield the floor back to Madam President.
Thank you so much, Executive Director Maddox, for championing certainly all of the work of the department and this very important webinar. Thank you so much. Our next speaker is a longtime leader in immigrant communities and the City Council member for Los Angeles' 1st District. In his decades of leadership in the State Assembly, State Senate, and City Council, Councilman Cedillo has been a leading voice for the rights of workers, renters, and immigrants. He authored the law which allows undocumented Californians to obtain driver's license, the ordinance which led to the creation of the Civil and Human Rights and Equity Department, and is the outgoing chair of the City Council Immigrant Affairs and Civil Rights and Equity Committee. Please help me welcome Councilmember Gil Cedillo.
Angelica, thank you so much for bringing us together, for your leadership, for moderating this. Of course, Capri, thank you for the 257 jobs that you're doing for the city right now. I appreciate that. I know that the mayor feels the same way. Obviously, Irene Tobad, mi reina, thank you for your incredible friendship and mentorship and leadership for years and years. It's a privilege to be here with everyone. I guess this may be the seminal, the first, the chartered webinar of the new Department of Civil and Human Rights, and it could hardly be more timely. In a pandemic, at ground zero in our nation, perhaps the world, where we're having the most adverse impact. I have the distinction of having some of the neighborhoods that are the most adversely impacted by this pandemic. We spent a very robust and productive afternoon yesterday with Barbara Ferrer, who's leading the efforts on the county side. And we came away with a couple points. We all agree that there's greater density in some parts of the city, districts 8, 9, 10, 13, 1, and 14. We recognize that in those neighborhoods that there's greater poverty, but there's also some other nuances that are critical at this moment. There's also greater workforce participation. And Ms. Maddox, you noted that many of them have multiple jobs, but also at their homes, there's multi-generational households. And those households where a typical household on the west side, a 2-bedroom apartment might have 1 or 2 people. Over in these districts, they may have 10, 11, 12, 13 people. It just is. And so it's critical that that population rises to the front of the line for the purposes of efficacy and equity. It's very key for us to understand that these households still continue to drive the service economy of Los Angeles. And so it is a point of equity, but it's also a question of efficacy. Because in that household is where the housekeeper lives, who's going to be taking care of the seniors who live throughout other parts of the city. It's Mr. De Leon referred to them, the more Tony parts of the district, the Brentwoods, the Bel Airs, the Westwoods, the Beverly Glands, the West Side, et cetera. It's also where the new, as we reopen up our restaurants, where the waiters, where the bus boys and bus girls, and where the back of the kitchen, where they work, preparing our food. And so it's a whole range of jobs that run our service economy, but they all seem to live at that same address in Pico Union or Temple Beaudry or down the Crenshaw corridor or down the 110 corridor. And so it's important for us to understand that for us to be effective in the distribution of the vaccines and making sure everybody's tested and assessing where we're at with COVID, that we are communicating in the appropriate ways to the appropriate communities. So one, while it may seem to many who are participating on this webinar that somebody would just enroll online. Sure, why not? Well, if we're targeting 65 and older, we need to recognize that that's not a reality. It's just not a reality. And so when I heard this being the priority on Monday, I kind of frowned because I know the other reality is that 65 and above, boomers, boomer immigrants, as people get up in the years, they're not on the internet. Shocking. But they're on the telephone and they want to know, who do I call? And so yesterday we were happy to hear that the phone services will be expanded, that they're 12 hours a day, 8 to 8, and that they're in all languages. And so that will be helpful for us. We were also happy to hear that many people are homebound. And because they're homebound, and because of the type of transportation systems that we have in the city, they're not able to get out. And so if they work with the city and with the Los Angeles Fire Department, we can get you your vaccine. We can make sure that people are vaccinated in their home. That's very important. We came to an understanding that it's not simply a lack of access to the internet, but it's also the fact that people don't have capacity to utilize it. So assuming there is internet, whether it's at the library or there's a hotspot or LAUSD has given us the resources to do that, the boomers, the 65 and above, they don't have the capacity. And so if our goal is to get the most critical, the most strategic communities vaccinated in that order, then we have to figure out how we communicate to them. It's got to be language sensitive. It's got to be demographically sensitive. It's got to be zip code sensitive. And so I think yesterday we had a conversation that will help us as we go forward get on the exact right track to make sure that we're able to vaccinate the most critical populations. We are at the end. There is a light at the end of the tunnel, but it's not, next week. It's not next month. We still have a way to go, and we'll only make that progress if we are as effective as we can be in terms of moving this agenda forward. And so I thank you for having this seminar. I thank you for making sure that it's in Spanish. My campaigns are in at least 6 languages, and it's because we believe that everybody has a right in this city to live in the city regardless of their immigration status, regardless of where they come from, regardless of gender or age. They all have a right to live in the city with a modicum of dignity and respect, and with those basic opportunities for civic engagement and civic participation. Again, thank you for your leadership. Let's have a great webinar, and again, let's go forward. Let's lean in on this pandemic, and let's finally move towards the light. Thank you so much.
Thank you so much, Council Member Gail Sevillo, for joining us for your remarks. You've brought up a lot of key issues and that we hope to be able to address during today's webinar. We have incredible panelists to share the latest information on COVID-19 and the resources that can support and serve immigrant Angelinos. Dr. Paul Simon is a Chief Science Officer at the Los Angeles County Department of Public Health and an adjunct professor in the Department of Epidemiology at the UCLA Fielding School of Public Health. Welcome, Dr. Simon. We also have Nora Preciado, who is a director of Mayor Eric Garcetti's Office of Immigrant Affairs. She is passionate about immigrant rights and has 15 years of experience advocating for the rights of low-income immigrants and refugees. Prior to joining Immigrant Affairs, she was a supervising attorney at the National Immigration Law Center. Welcome, Nora Preciado. Amanda Daflos established the I-Team in 2015 and led the team for 5 years before moving into her role as Chief Innovation Officer, where she now oversees the I-Team and a broader portfolio of work for Mayor Garcetti. And Veronica McDonald is Director of Program Operations of the Los Angeles Housing Community Investment Department, Community Services and Development Bureau. Veronica oversees the implementation of several social service delivery programs, including the Family Source System, domestic violence and human trafficking shelter operations, homeless services, and the housing opportunities for persons with HIV/AIDS program. Thank you to all of our panelists for being here. We're going to jump right into questions. Dr. Simon, we know that COVID-19 has devastated our country in a way that we couldn't have imagined. and immigrants and underserved populations within our county and our city are amongst the most impacted in terms of the number of positive cases, deaths, and financial devastation. There's also a tremendous amount of misinformation or lack of knowledge as to what to do when someone tests positive. Can you tell us more about the health implications of COVID-19? And what do you advise if someone tests positive? What should they and members of their households do?
Well, thank you. I first want to thank the Department of Civil and Human Rights and Equity for the invitation today, and also want to express my deep appreciation, and on behalf of the Department of Public Health, express our appreciation for the partnership with the City of LA. You've been incredible in all of your supportive efforts, from testing to now more recently helping with vaccinations to community outreach and education. This pandemic demands a response from all government entities and really all sectors. So let me just begin by talking a little bit about the pandemic overall. And I think this week is noteworthy because it is the 1-year anniversary, Tuesday actually, the 1-year anniversary of the first reported case in Los Angeles County of COVID-19, and that was in a traveler. I don't think any of us believed that we would be where we're at today. At that moment a year ago, things were relatively quiet until early March, and then we began to have some additional cases reported, including some in which it was clear that there was local transmission, not just infection among travelers. And since then, we have seen over 1 million reported cases of COVID-19. These are laboratory confirmed cases. We know that's really only the tip of the iceberg based on other studies we've done. We estimate between 3 and 4 million Angelenos have had the infection over the past year. It's had a devastating impact, I think, as Capri mentioned, not evenly distributed across the population, and I'll talk a little bit more about that in a moment, but overall more than 15,000 deaths. And just to put that number in perspective, overall we see about 60,000 deaths each year from all causes combined, everything. And in the course of just 1 year now, 15,000 deaths. If you look at other causes of death, the leading cause of death in Los Angeles County for years has been heart disease at about 11,000 deaths per year. So COVID-19 is the leading cause of death. We were doing quite a good job, I think, all of last year in suppressing the pandemic, and so in the so-called flattening the curve. We were doing much better than other areas of the country. But sadly, beginning in November, we began to see a surge. It accelerated towards the end of November and continued on into December and early January. We think it very simply reflected increased gatherings around holiday time, for example, with our professional sports teams winning titles, people getting together to celebrate. We'd had almost a year of social isolation for many people, and overwhelming. And so it's understandable that people came together, but we're facing the consequences now. Fortunately, we are seeing a downturn in the surge over the last 1 to 2 weeks. Very, very good news. We're continuing to see a high number of deaths, sadly, but we're hoping that will also go down soon. It's very important, though, that we remain vigilant. As you may have heard in the news, there is a new variant that is present across the country at a very low level right now, but there's some evidence that it spreads more easily, and concern that if it does so, it could become the dominant strain in this country by the spring. And so it is really important that people continue to practice those measures that we've been recommending for the last year, using a face covering, physically distancing whenever outside the household, and trying to avoid large gatherings as much as possible. So let me, though, get to the question about what to do if you test positive. And let me preface that by saying that, of course, what we want to do is prevent people from testing positive. And so in addition to those preventive measures I mentioned, like face coverings and physical distancing, I think it is important before you have been diagnosed with COVID, and hopefully fewer and fewer will be, to identify a primary source of healthcare. Many already have a primary source of healthcare, but many do not. Excuse me. So it is important to be proactive. And if you're not sure where to go to find that primary source of care, you can call 211. There's a very extensive network of community clinics that can provide support, so that if you are diagnosed with COVID, you have someone you can call to get information. But just very briefly, it is important if you test positive to, excuse me, it is important to isolate for 10 days. And we know that is very difficult in a crowded household, but to the best degree possible to try to remain in a separate room from everyone else. But if that's not possible, to make sure that you're wearing a face covering and trying to keep at least a 6-foot distance from others in the home. It's important to let any close contacts know, not only those in the household, but others, that you've been diagnosed with the infection, so that those folks can quarantine. People should quarantine for 10 days. Those with infection should isolate for at least 10 days, but also additionally isolate until there's no longer fever and your symptoms are improving. I'll close by saying there is lots of detailed information on our website. You can go to vaccinatelacounty.com, and in the upper left-hand corner, you can link right over to our main COVID page to get all kinds of information. But as the council member mentioned, of course, many people in the county don't necessarily have access to a computer or aren't comfortable using the internet. And so we do have a phone number that folks can call. It's 1-833-540-0473. I will say that unfortunately over the last several weeks, that call center has been overloaded because of the expansion of folks eligible to receive the vaccine. We've been overwhelmed with calls, over 20,000 a day. We are expanding that call center as quickly as possible, but be patient with that. We'll do our best to try to meet your needs. Thank you.
Thank you so much, Dr. Simon. And I want to assure everyone that we will be posting the information that is shared out, such as the county phone number and website on the city's department website. And we'll have more information about how to access that towards the end of our webinar. Thank you so much, Dr. Simon. Amanda, we know that the city and county have been working and coordinating the COVID-19 response, but it has also been difficult for many of our community members to know where to find help and how to find the information they need. Can you tell us a little bit more about the overall city's response and where to find information about COVID-19 help? And is this information available in different languages for our different community members?
Sure. Well, first of all, I want to also echo the thanks and appreciation for the opportunity to join you all today. I think this is, one of the most important things that we can be doing is getting together and sharing information about how residents can learn more about COVID, learn more about the city and the county's response, and also find tools that can help them and their families. So once again, thank you all very much for having me and for pulling this together. In my role, I've had the opportunity to work on behalf of the mayor to drive some of the city's COVID response. And that has meant a whole variety of things over the last year. Some of the things that it's meant, I wanted to share with you today in terms of resources. So I'm going to go ahead and actually share a few slides, which hopefully you can see now. The first thing I wanted to note is that the city of Los Angeles is one city within the county of Los Angeles. So the county is responsible for the full response to COVID. And the city of LA has been doing everything in our power to support Dr. Ferrer, Dr. Simon, the Board of Supervisors, and importantly, our residents in the sort of need to get access to both resources and information. One way we've been doing that is by setting up a website specifically for coronavirus, for those that might have questions or need access to information. So we've posted that website up here. It is easily found, however, by lamayor.org. So you can go online, hit lamayor.org, and in the top right hand, you'll see a yellow bar of print that says coronavirus response. And from there, it'll link you to a whole variety of different tools. We provide the current status on the pandemic in Los Angeles. For example, every day we produce a volume of data about the city. So how many people in the city, for example, have coronavirus, a breakdown of hospitalizations across both the city and county. Again, really supporting all the important work the Department of Public Health is doing. And there are some tools there to help better understand ways to keep your family and your friends safe and healthy. For example, and there's a whole variety of suggestions around different things people can be doing in lieu of gathering. There's information about sites that are open but are outdoors, so can be used in a way that is sort of acceptable in the time of a pandemic. There's also a variety of links to our testing sites, and the city of Los Angeles has now tested nearly 4 million people over the last year. And we've done that through hosting a variety of different testing centers in partnership with the county. So there's information not only on how to book an appointment, but what to do if, in fact, you're positive if you get a test. But you can make an appointment for a test if you feel like you need one, if you suspect you've been exposed, and there's a link to actually be able to get a test. And there's a whole series of other links there as well. But I'd encourage everybody on today's webinar to access lamayor.org. The easiest and fastest way, or you can link directly with corona-virus.la. The website is available in multiple languages, notably Spanish, so you can access all that information in both languages. I wanted to put up a slide. This is important information that's been shared by the County Department of Public Health. As Dr. Simon noted, you can see all this for yourself by visiting vaccinatelacounty.com. And that website's really important because as we move hopefully toward a point where we're beginning to vaccinate people now, and hopefully over the course of the next several months, vaccines become more widely available. It's both important right now to have patience because we all have heard and are now seeing play out that it will take some time to vaccinate everybody. But some of the things that you can do now are visit vaccinatelacounty.com and learn about where you might fall in when it's your turn to get a vaccine. So very importantly, the county has posted this information for everyone's awareness and knowledge. For example, I myself don't fit into any of these categories, so I wouldn't be eligible right now. But at some point, maybe in March, April, May, June, maybe I would become eligible. And so I will continue to keep checking back to be sure I know when it's my turn to get a vaccine. In terms of the city's role with vaccines, as noted, the city is one city in a county of 88 cities. So the city has stepped up to try to accelerate vaccines and really add to the volume that the entire county can do. And one way we've done that is we've sort of become in our own way what I keep calling sort of a pharmacy. So the county now has almost 200 sites that are offering vaccines to those that are eligible and make an appointment. The city is one of those providers, similar to a pharmacy, similar to a hospital. We now are also offering vaccines. In our role as a vaccinator, we're an approved vaccinator by the Department of Public Health. And we've launched 5 vaccination sites across the city of Los Angeles at Crenshaw, Dodger Stadium, which is a very large site, Lincoln Park, San Fernando, and Hanson Dam. And in the coming weeks, we're also going to be working with the county to launch mobile units so that for those that are in qualified tiers right now, if for some reason they're unable to reach a site and they do qualify and have an appointment, and we can actually be bringing vaccines to you. So the city is acting as a vaccinator. As I noted, on lamayor.org, you can learn more about how to sign up for a vaccine through one of the city sites or one of the nearly 200 sites that the county has operating countywide at this point. Here's some information about how you would sign up for one of our sites. There's a portal that you would be able to check your eligibility. And then if you're eligible and there are appointments available, you would be able to sign up using this portal. And to just echo Dr. Simon's note, importantly, for those that don't have internet access and want to sign up for an appointment, down here at the bottom of the slide, you can see the number that Dr. Simon mentioned, which is 1-833-540-0473. And that hotline, thanks to the county, is open 7 days a week from 8 a.m. to 8:30 p.m. for assistance making an appointment. I do want to note that appointments right now are very limited, and the reason why they're limited is because the supply of vaccine, as noted by Dr. Simon and myself, right now is limited. But as we get into the coming months, it's expected that that supply will increase, and therefore appointments will also increase. So not only Angelenos, but people across the country are being thanked for their patience at this point. And then lastly, just to close out sort of my remarks around what the city is doing, the city has elevated a wide variety of programs, everything from ensuring that those that need support with groceries have support with groceries, to supporting important things like COVID care kits, and being able to be sure that those that need things like thermometers, masks, or other supportive supplies during the time of COVID can get them. And so I would just encourage that for those that might need support on accessing PPE like hand sanitizer and masks, other types of disinfectant, or even educational materials about the vaccine, and that you visit lamayor.org and look for ways to access the COVID care kits. These are really important tools that we know Angelenos would like to have, and so we would encourage folks to either reach out with questions, or if you can't access it through the website, or find your way through the website. But again, support kits, including information about COVID, when to get tested, what to do if you're positive, and then also important things about the vaccine for those that would like to know more about what it is, and why everyone should get one when they're eligible. With that, I will say thank you and hand it back.
Thank you so much. Nora, it's really helpful to see where and how those in need can access resources, but we also know that there is a lot of fear and misinformation. As the director of the Immigrant Affairs Office, how has your office in the city worked to provide better access to information? And how do you ensure that that information is reaching diverse immigrant communities?
Thank you, Commissioner Solis Montero, Human Relations Commission, and Civil and Human Rights and Equity Department for the invitation to be a part of this important conversation today. Before addressing your question, I want to just put a little bit of additional context around some of the work that Mayor Garcetti's Office of Immigrant Affairs is doing to ensure that all Angelenos, regardless of their immigration status, have accurate, life-saving information and resources they need during this pandemic. As Dr. Simon, Amanda, Capri, and others have mentioned, we're all aware of the disproportionate impact of COVID-19. As Mayor Garcetti likes to remind us, although this virus doesn't discriminate, its impact certainly does. And it's most severely felt by communities of color, and that includes our immigrant communities. Nationally, according to a November 2020 CDC report, the rate of hospitalization across the nation for Black and Latino communities is 4 times higher than that for non-Hispanic folks. And obviously,
that includes a lot of immigrants that are being disproportionately affected. In LA County, the story is no different. Latinos account for more than 50% of COVID deaths, and those that live in areas with the highest rates of poverty have a mortality rate 4 times higher than residents living in the wealthiest neighborhoods, as Councilmember Cedillo and others have mentioned. And we do know some of the causes of this disproportionate impact. Nationwide, the latest study showed that 69% of low-income residents of color have jobs that are deemed essential. Many live in multi-generational households and more crowded accommodations that make it difficult to contain the spread of the virus. And because of inequities that we all know predate the pandemic, many of them lack access to proper health care, which is crucial at this point. And as a result, Black, Latino, and immigrant communities are more likely to have underlying health conditions that increase the chances of them getting COVID-19 and determine the severity of their symptoms. Now, in the city of LA, the strength of our city lies in its diversity. We are a city of immigrants. In a city of 4 million people, 1.5 of them are immigrants, and approximately 400,000 of them are undocumented. This adds unique needs and concerns that we have to address to be responsive during the pandemic. And now, why do I mention all of this? All of this matters when we talk about accessibility and how to reach our immigrant communities in the city of LA with timely and accurate information and resources on COVID-19. In terms of outreach and accessibility, from the beginning of the pandemic, our office has been working very collaboratively to help develop accessible city programs and initiatives in response to this pandemic. We're ensuring that we address language barriers and concerns about interacting with the government, which has been mentioned. We're limiting burdensome and unnecessary documentary requirements to access those programs. We are protecting the confidentiality of any information that is provided when people access our city programs and initiatives. We're being sensitive to and responding to the digital and technological divide, as has been mentioned. And we're addressing mobility and transportation issues. Those are just a few of the concerns that are very unique and arise with our immigrant communities. As far as outreach to those communities, we are coordinating intensely and communicating with other mayoral offices here, as well as city departments, including today's co-host, the Department of Civil and Human Rights and Equity, as well as very closely coordinating with our external partners like the county, CORE, and community organizations and leaders throughout the city. Again, our goal in this office is to provide timely, accurate, and effective information and resources to the community. We believe we can do that by using existing data about where COVID-19 is having a greater impact, what neighborhoods, what populations are being affected, looking at the trends. This helps us narrow in on our targeted outreach. For example, Volunteer LA and their cadre of amazing volunteers has helped us canvass neighborhoods where we see an increase of cases or death rates. We do this ahead of mobile testing, sharing our materials. We also try to make all our materials responsive to the current needs by including not just information, but what people really need as well is resources, where to go for help. Again, resources that are available regardless of immigration status. By making this information language accessible and culturally sensitive, we try to address this need. As Amanda mentioned, language access remains a priority in communicating with Angelenos during the pandemic. The mayor's communications team, our office, Commissioner Jessica Calosa, and many others are working tirelessly to ensure language access. As Amanda mentioned, the City of LA, our webpage on COVID-19, has the Google Translate tool that allows constituents to access information in their preferred language. And our key education and outreach materials have been translated in multiple languages. For every press briefing, as many of you have seen, the mayor provides updates in Spanish whenever he talks about COVID-19. He also uses his social media platforms to post in multiple languages, including many infographics infographics to address literacy issues, or recorded videos with Spanish subtitles. We know that a lot of our immigrants use social media as a way to get their news and information. So this is really important. And the mayor also does interviews very often in ethnic media outlets. But again, we continue strategizing and soliciting feedback from the community, our partners, in order to improve in this area. And this work, as Amanda and others mentioned, becomes even more important as the vaccination efforts are continuing and ramp up. And finally, to address your question squarely, I do want to mention some immigrant-specific resources that we are putting out to try to address all these concerns. The Mayor's Office of Immigrant Affairs put together a few COVID-19 immigrant-specific resources that are available to all Angelenos, regardless of their immigration status. The Mayor's Office of Public Engagement back in May conducted an informal survey in the community to learn about what the information and resource gaps were when it came to COVID-19. Based on that survey, we created a flyer that has been distributed widely. Our Caring for Myself and My Community flyer, created with the Mayor's Office of Public Engagement, contains tons of information about COVID testing, preventing the spread of the virus, the contact tracing process, which also causes some anxiety in our immigrant communities. And so we wanted to dispel misinformation and fear and address fears. It contains information about how to quarantine, medical sheltering resources, and more, all in one place. The flyer has links to more information, phone numbers, and websites so that people are able to access those specific resources when needed. It is available in 8 different languages: English, Spanish, Korean, Eastern Armenian, Simplified Chinese, Thai, Farsi, and Russian. And we also have created a simplified version of this flyer with QR codes. I was not tech savvy, but I learned all about QR codes and how much easier it is. You can pull out your phone and basically have this information at your fingertips. Mayoral offices, city departments, our community partners, community leaders have supported our outreach efforts into all of these disproportionately impacted communities by helping us distribute this flyer very widely. And last, I want to mention our COVID-19 resource guide for immigrant and refugee Angelenos. This is a comprehensive COVID-19 information and resources document. It provides information about programs related to healthcare, relief funds, food security, legal services, and more. We update this document weekly, so we encourage people to share it widely since the information it contains will not go stale. And it also gets a good overhaul once a month. So all of the information is up to date, and you can see the date at the top of the document so you know everything's updated. A condensed version of this guide is also available on the Mayor's Coronavirus website by going to coronavirus.lacity.org/resources. Commissioner Solis Montero, as you can see, we have been busy making sure that all Angelenos have accurate, language accessible, and culturally sensitive information about COVID-19 and related resources that they so desperately need to stay healthy and safe. Thank you, and I'll turn it over back to you.
Thank you so much, Nora, for all of that wealth of information. Again, I want to reiterate that we will be sharing where you can access the information that's been discussed by our panelists today towards the end of this webinar. So you'll have directly where you can access all the information. Veronica, the family source system has been an important part of serving immigrant communities throughout the city. And with the COVID-19 hitting hard and devastating immigrant populations, how has the family source system been used to help provide resources and support?
Thank you, Commissioner Solis Montero, for the question. We really appreciate the opportunity to share how our family source system is being used to provide resources and support for Angelenos, specifically immigrant populations. But first, to provide some context for anyone who is not familiar with the family source system. The Family Source serves as the city's delivery system for anti-poverty initiatives and essential services. The Family Source system is comprised of a network of 16 community centers that deliver coordinated and integrated services to city residents in areas of highest need. and is housed under the Community Services and Development Bureau of the Los Angeles Housing Community Investment Department under the leadership of our Assistant General Manager, Abigail Marquez. COVID-19 has had a devastating impact on our most vulnerable populations and has created a crisis in housing, food, and economic stability. Our Family Source system has a built infrastructure that has allowed the city to respond quickly to this global pandemic and help those most in need. In the days following the Safer at Home order, our Family Source centers provided direct aid and relief to families, and they continue to do so. Some of the resources and support that they're currently providing are support students. So we offer online tutoring and homework assistance, primarily to middle and high school students. We provide landlord-tenant related issues. This includes limited support with rental assistance, rental arrears, unpaid utility bills, access to food. Several of our Family Source centers operate a food pantry and host weekly food distributions, and we have seen such a high increase in this area. We've had centers serve upwards to 200 in 1 week, now to 1,000. So the increase and the need really demonstrates access to food, helping access economic impact payments, unemployment benefit insurance, income tax credit, and other public benefits like CalFresh, assistance with debt consolidation, negotiation tactics, and mediation services to manage debt collectors during this time, credit counseling services to help Angelenos establish, improve, and rebuild their credit, immigration services. Each of our Family Source centers partner with a legal service provider to help navigate immigration services and provide support. And as we approach the tax season, our Family Source centers will be offering free tax preparation by IRS certified tax preparers. And so we know that will be helpful, especially as families get ready to file, and the cost to file is sometimes really high for families, but they can get free services at our Family Source. All of our services are free and eligible. And families that are eligible, there's only 2 requirements: that they live in the city of Los Angeles and that their household meets the income guidelines. So that's the only 2 eligibility requirements we ask for. We streamlined our intake process so that we can quickly serve as many clients. And if you know of anyone, or maybe yourself, you need any of these types of services, you can visit our website at hcidla.lacity.org and click the tab Community Resources to find more information about a Family Source center near you. And I'll turn it back to you.
Thank you so much, Veronica, for all of that information. Dr. Simon, we heard Amanda share a little bit about the vaccine availability and how to access information about getting the vaccine. But we know that there are a lot of questions related to the vaccine itself, like, is it safe? How much does it cost? Can I get COVID-19 if I get the vaccine? What should people know about the vaccine?
Thank you for that question. Let me start with that first question: is the vaccine safe? And I think that is a very good question. I think all of us had some concern because of how rapidly the vaccines were being developed. And when the data finally came out from the vaccine trials in early December, and it was quite a transparent process. The data were provided to an advisory committee of the Food and Drug Administration, but it was made available to everybody to see. I think all of us in public health were really very pleasantly surprised at the results. There were over 70,000 persons that participated in these 2 vaccine trials, and the vaccine was found to be very safe. There were the common sort of reactions that we see with many vaccines that are relatively mild, things like fatigue, for example, soreness where you receive the injection, muscle ache, sometimes a little bit of fever and chills, but typically that would occur within a day and only last for 1 or 2 days. But the more severe reactions, serious reactions, were not found in these trials. We've now had the benefit, actually, of across the country having administered more than 20 million vaccine doses across the country. And so we have additional data, and it really does indicate that the vaccines are very safe. The only reaction of concern has been one that's very rare, and that is a very severe allergic reaction called anaphylaxis. And the Centers for Disease Control did a study that found that so far we've seen about one of those reactions for every 250,000 vaccines that are administered. So it is quite rare, but it does underscore the importance of providers, vaccine providers, having the medications available if someone were to have an anaphylactic reaction. It's a very treatable reaction. Secondly, how effective are the vaccines? And here again, we were amazed. Most vaccines are maybe anywhere from 60 to 70% effective. These two vaccines, the Moderna vaccine and the Pfizer vaccine, were found to be 95% effective. So there's no question that these vaccines are going to save thousands and thousands of lives. So we really are encouraging persons to be vaccinated. We do understand that there is hesitancy among many, and for a variety of reasons. It may be personal reasons, bad experiences in the past with the healthcare system. It can be the long legacy in this country of discrimination, and in some cases, frank racism related to how different groups were treated. I can only say, I can only share though my perspective based on what I've seen so far of the vaccines and the data we have. I think they are both very safe and effective. Now, with regard to cost, these vaccines should be free for everybody. If you have insurance, your insurance company will be billed when you register to receive the vaccine. They'll ask for your insurance, but if you don't have insurance, doesn't matter. You will receive the vaccine free of charge. Immigration status does not matter. In fact, we don't even ask. We don't want to ask because we don't want to discourage anybody from being vaccinated. All are welcome. There are a lot of myths, I think, out there, particularly in the internet, about the vaccine. For example, as I think it was mentioned in the question, can the vaccine cause COVID-19? And here I will say categorically no, because there's nothing in the vaccine that is part of the virus. There's no live virus or even killed virus in the vaccine. What is in the vaccine is a small piece of genetic material that's created in the laboratory. And once that is injected into your body, that genetic material is used by the cells in our body to produce a protein or an antigen that the cells then release that trigger the immune system to produce antibodies that will prevent you from getting COVID-19 in the future. This genetic material that's in the vaccine, it actually gets destroyed very quickly by the body within several hours. So there's no long-lasting effect. Now, others, though, have said, well, gee, it is genetic material. Could it impact my genes or my DNA? Again, categorically no, because this vaccine doesn't enter the nucleus of the cell. It's just in other parts of the cell, so it never touches our own body's genetic material. I have heard some concerns that it may cause infertility. And here again, no evidence of that. And in fact, even in the vaccine trials where the researchers decided not to include persons who were pregnant, there were a number who did become pregnant during the trials. So we learned there that it didn't seem to impact fertility. And then now, again, with the millions of vaccines that have been administered, we've not seen any evidence that those receiving the vaccine have reduced fertility. With regard to the rollout here, and I think several folks maybe have mentioned this, there is an extreme shortage of vaccine, unfortunately. Under ideal circumstances, we were hoping for about 500,000 doses a week, 500,000 doses a week to be received in the county. And that would have then allowed us to vaccinate about 75% of all adults in the county over a 6-month period. So even under ideal circumstances, it's going to take about 6 months. Unfortunately, we're not receiving 500,000 doses a week right now. We're only receiving about 150,000 doses, which clearly is not adequate. That would require then us to take about 18 months to vaccinate everybody. We're pretty confident the supply is going to increase, but we can't make any promises till we actually see it. The state is transitioning to a more centralized system of distributing the vaccine out to a network of vaccination providers. I think that system is going to really emphasize the healthcare system. And so here again, I'll emphasize the point I made earlier that I urge everyone to make sure they have a primary source of healthcare. And if they don't have that, don't hesitate to call 211, where you can get some assistance in identifying a source of healthcare. But while we'll learn a lot more about what the state's plans are over the next 3 to 4 weeks when this transition is going to be completed, we do think there will be flexibility to deliver vaccine to highly vulnerable populations that don't necessarily have access to healthcare. So for example, persons experiencing homelessness, agricultural workers, for example, a very important group to reach, may need extra support to get vaccinated. The groups that are currently eligible to be vaccinated include all frontline healthcare workers in LA County. That's about 800,000 persons. All seniors and others living who reside in long-term care facilities, including those in skilled nursing facilities, several 100,000 people there. And then those 65 and older, we estimate that population to be about 1.3 million persons. So it's a large group. We're working through that as quickly as possible. And again, as we get more vaccine, clearly we'll be able to accelerate efforts. The next group that will be eligible, and we're hoping that these groups can begin getting vaccinated in February, probably mid-February, will be those working in food and agricultural sectors, emergency responders and public safety officers, those working in education, teachers, other school staff, and those working in childcare. Beyond that, it's not clear exactly how the vaccine will be rolled out. The state is talking about shifting to a purely age-based approach. We do know that with each increasing age, the risk of severe COVID illness and even death goes up greatly. And so once we're well into the 65 plus group and the other group, occupational groups I mentioned, we'll be then extending out to those 50 to 64 years of age. I've received a number of emails from persons who are understandably very concerned and in some cases upset because they have a variety of chronic health conditions that place them at an increased risk for severe illness with COVID. And they've said, well, gee, if it's just an age-based approach, when am I going to be able to get my vaccine? It just doesn't seem fair. And I will say, I think there'll be some latitude among healthcare providers to prioritize those who have chronic health conditions so that they can be vaccinated first. So we do hope there'll be flexibility in the system. Thank you.
Thank you so much, Dr. Simon. Amanda, you talked a bit about the coordination between the city and the county. Can you speak a little bit about the city's role in coordinating and accessing information and resources from the state and the federal government?
Sure, I'd be happy to. Well, I would start by saying that Dr. Simon and myself have gotten to know each other very well over the course of the last year. I would say we spend, if it's representative of how closely we're working, we spend at least an hour a day on the phone, if not more. And I've gotten to know Dr. Simon's colleagues across the Department of Public Health very well. And the reason for that is because we're sharing as much as we can in the way of data, as much as we can in the way of resources, and ensuring that the city at every opportunity that we're called on, and at every opportunity that the mayor is called on, or even wants to put forward, we have the chance to work together to be sure that residents are getting what they need and have access to both information about COVID so that residents can understand, no matter your community, how COVID is impacting your neighborhood, how it's impacting your family, how it might be impacting you. And so much of that is sort of formulated the foundation in which the mayor talks about COVID, and again tries to really share information in sort of an open way with the public, just as Dr. Ferrer does, about how many cases we have, how many hospitalizations we have, and also what resources are available to people to help them and their families. I would note that probably two of the most remarkable partnership opportunities have been testing and vaccines. Mayor Garcetti and the City of Los Angeles, we're a very big city. We have 60,000 employees, and we serve 4 million, slightly more than 4 million residents in a county of 10 million residents. So we have an infrastructure that allows us to pivot when we need to, and provide that added support to our colleagues at the Department of Health, and in the end, the people that we're all trying to serve, which are Angelenos. And so in the case of testing, I think I noted that we were able to quickly stand up an infrastructure that offers testing across the entire city of Los Angeles at no cost to residents, requiring no form of real identification. Doesn't matter if you're a resident or a citizen or not. You can get a test if you need a test. And we're aspiring to do that very same thing on vaccines. To date, we've already, I think at this point, vaccinated about 190,000 people in our city's vaccine infrastructure. And that is only made possible because of the collaboration with the county and because of the collaboration with the Department of Public Health. And so back to the phone calls, of those doses that Dr. Simon mentioned that we're getting, we spend a lot of time on the phone each day, really just figuring out how many doses the city will get and what we will then be able to make available in terms of vaccine to people at our city vaccination sites. But again, I would say that, as the county and as the city and as even the state, the pandemic requires that government work together and try to be as on point and on message as possible to ensure that residents, to the extent that we can, these are really large agencies that are responsible for a wide variety of services in a non-pandemic time, but in a time of pandemic, everyone is trying our very best to coordinate to be sure that there's one message that Angelenos and people across the county can trust.
Thank you so much for that, Amanda. Nora, it's been mentioned now a couple of times regarding critical immigration status information and whether it's required, whether it's being taken either for testing or for the vaccine. But I want to get a little bit more into that, because in addition to those fears, people are also having questions about whether getting tested and treated for COVID-19 or receiving care at a hospital or a clinic would threaten, for example, a person's ability to apply for a green card or citizenship under the public charge rule. There's a lot of questions about whether healthcare services can be provided for persons who are undocumented. Can you share what we know to be truth in terms of alleviating some of these fears for persons that may have them and have questions about this?
Absolutely, that's an excellent question. The most important thing right now is ensuring that everyone in the city and in the county remains healthy. If people have been exposed to COVID-19, we need to make sure that they get tested and follow the county public health recommendations. If people are sick and think it may be coronavirus, we need to get them medical help. And we need to get everyone vaccinated when it's their turn. So the main message I want to get across today is it is safe for immigrants to see a doctor if they need care. Doctors should not be asking about immigration status. People should feel confident going to hospitals, healthcare spaces without any fear of any immigration enforcement. There are federal guidelines that prohibit immigration agents from conducting any enforcement operations at hospitals, doctors' offices, health clinics, and urgent care facilities. And health information is protected under federal law, so it cannot be shared with anyone, including immigration status for enforcement purposes. But again, doctors and clinics should not be asking about that information. As for access to healthcare, Dr. Simon mentioned this. Our county partners indeed run the healthcare system in LA, and their program, My Health LA, provides medical care both to the uninsured and underinsured, regardless of immigration status. So please do seek medical help if you need it. We also understand that how important it is for immigrant Angelenos to have access to mental health services during this very anxiety-inducing time. All LA County residents have access to the county's Department of Mental Health Access Center 24/7 helpline. And again, both of those resources, you can access them by contacting the county. And as an important reminder, the city of LA itself does not collect or keep immigration information unless it's required by law. So immigrant Angelenos can rest assured that they can freely access our programs and initiatives without any fear to their immigration status. And finally, because the public charge rule has caused a chilling effect in immigrants seeking the services that they qualify for and should be getting, I know that many of them, many Angelenos, immigrant Angelenos, are worried that seeking help during the emergency is going to affect that status. First, I want to remind everyone that the public charge rule does not apply to all immigrants. Second, many health and nutrition programs are not included in the public charge determination and are still safe to use. And finally, and probably most important, the federal government very early during the COVID-19 pandemic announced that they will not consider coronavirus testing and treatment as part of the public charge test. And vaccines have never been a part of the public charge test. So it is also safe to get your vaccine when it's time for you to do so. Again, I want to encourage anyone that has specific questions about public charge or any other issues that may affect their immigration status or they think may affect their immigration status to seek legal advice from many of the wonderful legal service organizations in LA so they can make personal informed decisions. A list of the providers can be found on our guide, which is on the mayor's immigration webpage, and you can find that at lamayor.org/immigration. But again, if I can get only one message across is it is safe to access COVID-related services, whether it's health services or other services, so that you all can stay healthy and safe. And if you have any questions, again, there are several resources that we can point you to get the advice that you need to feel comfortable doing so. Thank you.
Thank you so much, Nora. Again, to underscore, it is safe to access COVID-related services for all communities. Thank you so much. Veronica, can you tell us if there are any new programs or specific financial and economic support for low-income immigrants?
Yes, so I'm excited to share that there are 3 programs that will soon be launching that will provide financial and economic support for Angelenos. So one of those programs is Feed LA. Now, Feed LA addresses the emerging acute need for food security. As Angelenos are facing high unemployment rates and job instability, more households are struggling to figure out where they're going to get their next meal. So to ensure that families are safe and secure through this pandemic, the city is helping to fulfill one of these most basic needs, and that is a consistent source of meals. We have partnered with the Los Angeles Metropolitan YMCA and its network of 16 YMCAs across the city to provide grab-and-go meals, contactless grocery pickup, and grocery meal and delivery for isolated people, including seniors and people with disabilities. So that's one program. The other is YMCA will also help support our family source system with remote learning. So each of the 16 YMCAs will be providing online tutoring and learning pods for students. And then we are also really excited to have received an additional $200 million in federal and state funding that we will use to expand the emergency rental assistance subsidy program. Some of you may have already heard of that program. In July of 2020, we launched the program and we were providing a rental subsidy to city residents impacted by the COVID-19 health pandemic. And we will be expanding that soon. And then also in the next few weeks, we will be launching an eviction defense program that will provide Angelenos with legal services and financial resources to avoid eviction cases and to maintain their housing. And so again, this is open to everyone, regardless of immigration status. 8 of our family source centers will support these efforts by providing case management services through an integrated financial coaching model and offer temporary financial assistance to help support families. So we're really excited about that work and extending additional services to families.
Thank you, Veronica. We're at the end of our formal questions, but you've all provided such important and timely information. I'd like to open it up, Dr. Simon and others, if there is any last information that you want to re-emphasize or reiterate to those that are listening, or things that you think are really important for individuals to know, particularly for those that are working with immigrant communities.
Thank you. So I do want to mention that to schedule an appointment for vaccination, if you're in that eligible group, you can go to vaccinatelacounty.com. I know a lot of folks have had challenges in navigating that site. The system has been upgraded and it continues to be upgraded to better meet the needs of everyone. But I urge you to be patient because again, the supply of vaccine can't in any way right now meet the need. But for those of you who are in those eligible groups that feel particularly vulnerable, you can try that site and you might want to try it, each day. We are trying to build out a feature so that you don't have to continue to go back repeatedly. We hope we'll be able to go in, and if nothing is available, you can leave your name and contact information, get put on a wait list so that you can be contacted later when there is an appointment available. If you're not yet eligible, you can go to the site and put your name in and contact information, and will then be contacted when you are in a group that's eligible. One other feature that's being rolled out now, I think for most of the sites across LA County providing vaccinations, is that when you register for your first appointment, you'll also have your second appointment scheduled. There's a lot of concern because both of these vaccines are a 2-dose vaccine. There's been a lot of concern that people who've received their first dose might not have access to the second dose within that time interval that's recommended. For the Pfizer vaccine, it's 21 days after the first dose, and for Moderna, it's 28 days after the first dose. We are committed to making sure that everyone does receive their second dose on time. For those who received their first dose previously and aren't sure, in many of our systems, including the county system, you will receive an email. If you were vaccinated, received your first dose at one of our sites, you will receive an email directing you with a unique link to schedule a follow-up appointment at the same site where you received your first dose. And as a last resort, if you don't receive an email, but you had received a first dose at a particular site, we are letting all of our sites know that people, that they should be prepared to vaccinate all of the folks with the second dose if the person did receive the first dose at their site. So, thank you.
Thank you. One other question, Dr. Simon. What do we know about the effectiveness of these vaccines against the new variant of COVID-19?
That's a really great question. We're, as I mentioned earlier, we are quite concerned about particularly one variant that seems to be spread more easily. But Fortunately, what we've seen for this variant and a number of other variants that have been identified so far, the vaccines seem to work very well against those variants. Now, that may diminish as additional variants develop. The vaccine effectiveness may diminish. It's not going to diminish dramatically. It may go from 90%, 95% effective down to 90% effective. The flu vaccine is only about 60% effective because it's a virus that mutates very quickly. But I do want to urge, well, all of our partners, I think we all recognize that we want to roll out this vaccination campaign as quickly as possible so that the variants, don't result in lots more transmission within our communities.
Thank you, Dr. Simon. Nora, one last question for you is, can you address immigrant worker rights during COVID-19?
Yes, absolutely. Just quickly, I am a lawyer, but not practicing and no longer an expert on workers' rights, but I do have some general information to share with you. Protections are only as meaningful as the worker's ability to feel safe exercising them. And so the mayor and the city definitely have been keenly aware of the need to protect all workers, especially our essential workers during the pandemic. At the city level, the mayor announced worker protection orders mandating certain essential businesses to provide face coverings for employees, allowing businesses to refuse entry or service to members of the public without face coverings, again, trying to protect our essential workers, signed an order that fills the gap in the federal supplemental paid sick leave program, and announced an order also on worker retention and right of recall. Once the pandemic is over, a lot of folks who may be furloughed or taking or not employed at the moment have some protections to help them. Our office recently collaborated with the Loyola Immigrant Justice Clinic law students to create an informational flyer about immigrant workers' rights in the city of LA. This resource provides information on minimum wage, paid sick leave, overtime, the state COVID-19 protections, and other topics of interest. It's available in English and Spanish for now, and we're working on additional languages. You can download this and print the flyer on our Step Forward LA website, and that address is stepforward.lacity.org/workers_rights. It's a good, another good resource overall is the California Department of Labor's COVID-19 website. Again, accessible in many languages, and it has a chart that lays out the COVID-19 worker protections at the federal, state, and sometimes even the local level. And it has very helpful links to look at eligibility information because, again, immigrant workers are all, for the most part, protected as well. And finally, just to close out, I do want to give out the contact information for our office for anyone that wants to reach out to Mayor Garcetti's Office of Immigrant Affairs. You can find us by sending an email to mayor.immigrant.affairs@lacity.org, mayor.immigrant.affairs@lacity.org, or by phone, 213-978-0645. We are here eager to help you, provide information, and point you to resources. Thank you.
Thank you. Amanda, any final comments?
Well, I just want to thank everybody, of course, for listening and for the information, and maybe noting just one last thing on the city's vaccination sites in line with what Dr. Simon had shared. For those that may have received a vaccine at a city site, you are eligible to get your second dose timely with the CDC guidance about 28 days later from your first dose. In order to get that appointment, individuals will receive a text and or an email and an automatic appointment. So you will be notified, if you haven't been already, notified of your second appointment. So no necessary need to take action online to do that. I also wanted to note that individuals should trust the city and the county sites and their own providers. We are aware that there are some as unfortunately, like many things, oftentimes there can be actors who are looking to sort of capitalize on moments or be fraudulent in their offers about vaccines. And so I would just encourage everybody to be sure you're going to trusted sites like the city, like the county, like your provider, like a pharmacy, and not necessarily taking advantage of things that might come into your email that doesn't have a trusted source associated with it. But encourage everybody, as has been said before, when it's your turn to get a vaccine, and really think about it as a civic duty. An opportunity to really help build back our Los Angeles community and do your part in getting vaccinated. And with that, I'll turn it back to you, and thank you.
Thank you so much to our panelists for sharing your expertise and all of this really valuable information. I want to also again thank the Human Relations Commission, and in particular the Immigration Ad Hoc Committee and our chair, Commissioner Irene Tovar. We want to thank you all for participating. I'd like to bring it back to our Executive Director, Capri Maddox of the Civil and Human Rights and Equity Department for closing remarks.
Thank you, Madam Commissioner. It is truly an honor to be with you all as we share how we can make things better for all communities, particularly our immigrant communities. As Council Member Cedillo mentioned, we have multi-generational households. We have people that are working jobs, and your income, your immigration status, and your zip code should not impact how you survive this terrible virus. I think it's really important for us to thank the mayor and city council in general, but particularly City Councilman Cedillo for his leadership in this space to always be intentional about supporting our immigrant communities. We know that Dr. Simon mentioned that this is the #1 cause of death in Los Angeles County. The coronavirus is problematic for a lot of our families. And I think it's important for us to know that we have resources to help folks in this space, but we really want to let people know that it's fine to get resources, particularly as it relates to the coronavirus support, whether it is, medical assistance, mental health services, information about employment, et cetera. And I think Nora did a fabulous job of letting us know about those many resources. Really wanted to thank Veronica for helping us in understanding the number of resources that our family source centers have for us. And under the leadership of Abigail Marquez from the Housing Department, you all have just done a fabulous job in serving communities in need, particularly as people are dealing and facing housing insecurities. The fact that your zip code could impact how you survive this disease is troubling, and it's even more troubling that your immigration status could impact your thoughts about people's thoughts about how they can survive this virus. And so we wanted to just dispel some of those concerns in a substantial way, as well as dispelling some of the concerns people had about the vaccine. And I really appreciate Dr. Simon's leadership in explaining some of the challenges as it relates dispelling some of the myths as it relates to the vaccine. I want to be very intentional to just let you know that we are at a critical juncture here in this pandemic. But thanks to the Human Relations Commission, and more importantly, our ad hoc committee on immigration that was led by Commissioner Irene Tovar and others, I think it's really important for us to know that we are dealing with this pandemic. The vaccines have rolled out, and we do have a declining, case rate. However, I think it is, really important, as Amanda stated, that we're still not out of the woods, and we have challenges as it relates to communities of color and underserved communities. In December alone, the United States lost 140,000 jobs. Most of them were held by women of color, and many of them were held by by immigrants. And we need to understand that although the needs are big and we are leaning in as a city to deal with some of these issues and inequities, we are going to move from crisis to recovery. As we serve the 4 million folks of Los Angeles, we are going to recover, but we will be certain to focus on the needs of the underserved populations, particularly the 1.5 million immigrants that we have in this beautiful city of Los Angeles, as Nora shared. We're going to be focused on our hardest hit communities, particularly our immigrant communities. And so we're thankful for everyone sharing their knowledge today with the immigrant community service providers. The resources mentioned today, which are appearing on your screen, will be listed at civilandhumanrights.lacity.org. We will be posting a Spanish translation of this event as well. Nora has also placed information as it relates to coronavirus support in multiple languages. It is important that we all know that the resources mentioned today can be found on our websites, but they are also on the screen right now. I think just for our disabled population, I want us to be sure that we share this with the Department of Disabilities so they can post this on their website in the various forms that they can support their communities. And I just wanted to say, if you need more information about the resources shared, you can again go to our website, which is listed on the screen right now, civilandhumanrights.lacity.org. On behalf of the LA Civil Rights Department, our Human Relations Commission, and our panelists, along with Channel 35, thank you for joining us. And in the words of our mayor, peace and love to all of you in Los Angeles. Thank you.